I'm going to share. All right. Excellent. You should see my lead slide now, the truth about lower back pain and sciatica. My name is Troy Vander, and I'm a physical therapist, and I'm happy to have some time with you here tonight. I know your time is precious, and I appreciate you giving me some of it tonight. We used to do a lot of these, and we still do some of them post-COVID in person. It's really easy to interact in that format, but there is the possibility of interacting tonight as well. Even though I can't see you or hear you, sorry if you did your hair for tonight, I can't see you, no one can. But I can interact with you. So if you hit that chat icon and share any questions with me, I'll do my best in real time to answer them, but sometimes there's lots of them and it's hard to get to all of them. So I will promise to you I will get back to you afterwards. And I'm going to give you some contact information so that you can get a hold of me directly if you need to as well. Once you register, you've been getting some emails as a reminder of tonight's event. You can always reach out that way too. That doesn't get directly to me, but they always direct my team that organizes all this directs those to me. So those will get to me. Who is me? Why would you want to listen to me? Well, let me give you a very brief introduction. I am, as of the end of last month, a 28-year graduate of the University of Iowa's physical therapy program. Really value what I learned almost 3 decades ago in that program. It's got a high reputation, and it continues to do a great job of preparing students to be practicing physical therapists. The reality is you learn so much more actually seeing people. And so what you're going to learn tonight is what I've learned over 28 years of working with a whole lot of people with lower back pain. So I'm a doctor of physical therapy. I went to do my transitional doctorate about 11 years ago in a company called Evidence in Motion in Louisville, Kentucky. And I've been with Kinetic Edge. I got to redo this. I've been with Kinetic Edge since 2001. So it's been over 23 years. And the company, Kinetic Edge, has been in operation for about 26 years. It's not just me. We've got over 55 PTs and other rehab and movement professionals. Got a total of 90 team members, including our admin team, and 9 different clinics, plus our corporate office. And of all the see all kinds of musculoskeletal issues, lower back pain is the most common reason that people come to see us. Well, I can't remember the exact number, but I did some review a few years ago, and in the previous 3 years, I think we'd had 45,000. We've grown a lot in the last 3 years, so probably 50,000 plus sessions in the last 3 years on people with lower back pain. So you're going to learn about that because through repetition, you see tons of patterns that emerge. And one of the things we're going to talk about is why do the things that we do not really help? And what can we actually do that has some foundational capability of getting to the root of the problem? That's what we're going to talk about tonight. I'm glad that you're here. Some people get in this position and say, wow, I wonder if this is the right kind of workshop for me. So I'm going to tell you about the kind of people that benefit from this workshop. Maybe this is you. So many of the people that I talk to and that come to this workshop are kind of at the end of the rope. Most of them have been dealing with pain for quite some time. They've tried a lot of different things. They spend a lot of time, energy, and money trying to make themselves feel better. And yet most of them feel like they're actually getting worse as time goes by. They might get some temporary pain improvement through some kind of treatment approach, but it never lasts. And so as a result, they get fearful of moving and doing because there are things that they do and movements that they make that are uncomfortable for them. And most people, especially Americans, don't want to be dependent upon others. So if you find yourself becoming more dependent, want to maintain your independence, this is the workshop for you. And those kind of people ask really good, but sometimes tough questions like, will this ever go away? Can it go away? Or do I need to have some kind of a surgery or an other surgery? Many people that have been in this workshop have done surgeries and are still dealing with issues. If you're afraid of moving the wrong way, if you don't know what to do about this thing, and ultimately you understand that when you have pain, especially pain in something as important as your back, that tends to be used in everything you do, sitting and standing, moving, lifting, pushing, all that stuff. If you can't do those things well, you do less. And when you do less, it impacts your overall health negatively. We're going to learn today that the things that are most pertinent to your lower back are its closest neighbors. And this is a truth in life. We positively or negatively impact those that are closest to us. And we are impacted, for better or worse, most significantly by those that are close to us. And That's a truth in life, and it's hard to positively impact others if you hurt all the time. So if you find yourself getting short with others, just being in a bad mood because you hurt, this is a great workshop for you. I wish I could tell you that I could snap my fingers, give you one exercise, and this is going to go away forever. You're going to learn tonight that that's not the way that musculoskeletal issues are. And unfortunately, there's a lot of people out there promising you simple solutions for the right amount of money. Just do it and you'll be 100% better. There is no quick fix. We're going to learn tonight that these issues are cumulative, and usually the approach to making them better is cumulative as well. What we're going to talk about is pretty simple stuff, but it's not always easy to do. And the good news is it's not complex. And if you, like the tortoise, stay with it, the tortoise in that story always beats the hare. So if you find yourself looking for the quick fix and don't want to put just a little bit of work in and are more interested in masking your symptoms instead of getting to the root of the problem, this really isn't for you. But if you want help that is natural and gets to the root of the problem, that's what we're going to talk about tonight. I want you to hit that chat button, and that first question is the most important one I'd like you to answer, if you would, please. So tell me, in the past several weeks, is there some specific thing that you do that you know is going to make it hurt worse? Your back's going to hurt worse if you do this. What things are hard to do or make you hurt? Can you give me a list of that? And if you want to, you can answer then the following question too. How bad does that pain get on the 1 to 10 scale? And how long have you been experiencing it? And something as simple as days, weeks, months, and years, that kind of an explanation generally is good for me. Those last two questions, how high does the pain get and how long have you been experiencing it? Those don't really tell me whether I can help you. It might tell me how far along you've been traveling this cumulative path. And therefore, the process of getting better might take a little bit longer too. But that first question of what is causing it, what particular things make it hurt worse, is a really, really critical one. So we've got Dave saying walking and sometimes even standing. We're going to talk about the kind of pain that bothers people when they walk and when they stand, when they're in upright positions. I'm seeing Susan say lifting is hard. So, yep, that's a really common one. And then Jonathan says just bending over. Bending over gets the back of my lower right back pain makes worse. So Carol says sitting for long periods or standing in one place. So those are two different positions, Carol, but that's interesting. Jerry says to do stairs. Okay, that's interesting, Jerry. Thank you. I appreciate you guys giving me more feedback. I'm sure there's going to be more coming through. It sounds kind of weird, but if you can say specifically there's something that makes it hurt worse, it's kind of good news because we know that if your pain is reproducible with a specific action, it's also reducible. If your pain is reproducible, it's reducible because if you can reproduce it with a specific thing, it is most likely something that's called mechanical. Okay, we're going to talk a little bit more in just a little bit about this mechanical pain and what that means. You'll understand that pretty well in a little bit. Some of you said these things: walking and standing, we heard; sitting, bending, we heard, those kind of things. All of these activities are positions, postures, and motions that put stress on that lower back. So it's not surprising to hear those things. Those are the most common things that I see. For you to understand mechanical pain, you need to understand trauma. So when I say the word trauma, what comes to your mind? If you're like most, trauma elicits a connotation of major injuries, motor vehicle accidents, falls from a height, fractures of bones, those kind of things. Yes, those are all traumas. And those are specifically one type of trauma that we call acute. Acute means sudden trauma, sudden and significant. Acute trauma on this graph looks like this. Something happens and we experience tissue damage, and then time goes by. And over time, if it's trauma is the result of one specific stressor, a significant one, the tissue will get damaged, but when that stressor isn't repeatedly applied, the body is made to get better. We're organic beings that do get better over time. In many cases, when you have an acute trauma, even if it's a bone fracture, a cut, those kind of things, the body heals and it will eventually get better. And in most cases, it gets below the symptom threshold. We see this in our clinics quite a bit, these acute trauma issues, but the most common trauma that we see in the clinics are not acute trauma incidents. It's the cumulative stuff. And cumulative is different than acute trauma. It's not sudden tissue damage. It is slow, gradual, and progressive changing of the tissue that gets more severe over time. So that arrow that you saw, the last one that slowly went upward, took a few seconds on your screen, but that could literally be years of development. And the first of this is below the symptom threshold. So things are occurring and we're not even cognizant of it yet. And once it crosses the threshold, at that point, when people talk about their discomfort or their pain, they will say, hey, it's not that bad. It's there. It's not the same as it used to be. It's a little bit of a problem, but I can tolerate it. It's okay. And because of that, we kind of just continue living life and doing the same thing. And ultimately, for most people, that arrow continues to go upward. The farther it goes up there, the more significant it becomes, the more severe it becomes. Why do I have those buckets on here? Well, I'm kind of a visual person. Maybe you are too. And while cumulative trauma is slow and insidious, it's very predictable as well. When the body changes due to repeated small stressors, something very predictable happens. The first thing that we're going to notice is that we experience more fatigue. Okay. So I've been a physical therapist for over half of my life. As a young physical therapist, I could work hard all day, all week, and I had lots of energy. And I'm 53 years old now, and my body is different than what it was half a lifetime ago. I do get more fatigued. I need more rest. And I've not done really heavy work like some people have. If you have a more laborious job, yeah, that's even harder. A lot of those people tell me, man, getting through the day is hard enough. By the end of the week, I am shot. I rest on the weekend and I start to feel better, but then that next week comes again. I've talked to many people over the years that had to change jobs just because, hey, I can't do this kind of physical work that long. Fatigue is common. And unfortunately, if we just continue to do the same things that put a little water in our bucket, we collect more water in our bucket. And when we get a little bit more water in our bucket, that fatigue will turn into the next stage, which is discomfort. Discomfort is worse than fatigue, but it's not horrible. Most people would describe discomfort as a little stiff and sore and takes a little bit longer to get going at the start of the day. And you need more recovery to kind of get rid of some of these aches and pains that weren't as noticeable when we were younger. And again, most people understand, hey, this is going to happen. We're no longer spring chickens. It's typical. I don't want to be a squeaky wheel. I'm just going to learn to live with it. And so we keep adding water to our bucket. We don't change things, and more water fills that thing. And eventually, in most cases, discomfort gives way to something more significant, pain. This is not just stiffness and soreness. This hurts. We all know what that is, right? And if we continue to let this water fill, eventually we have a spill. And that's when we have true tissue injury. And that takes a lot of time, energy, and money to make it get better. So our goal is to teach you how to move in this direction, how to eliminate some water from your bucket, or maybe to build your bucket up a little bit more so you can take on more water. Those things are important. So that is a descriptor of the cumulative trauma process. Another thing is this railroad track. Okay, is this the path you're on? If you look in the distance, rounding the bend, there is a train coming. Okay, so but just imagine what this might have been like a couple minutes prior to this photo being taken. You don't see the train because it's too far off, but you might hear a distant whistle or maybe a little bit of vibration on the railroad tracks before you even see that train. And now just imagine another 30 seconds, that train's getting closer and closer. It's bearing down on you, and that whistle's getting louder, and the vibration is getting more and more violent. There are significant signs that doom is pending with this. So it isn't the same for people with cumulative trauma. It isn't sounds and vibrations. The things that will tell you how far along you've traveled this cumulative trauma path has to deal with the frequency, intensity, and duration of your symptom. As you collect more water in your bucket, your symptoms will become more frequent, more intense, and longer in duration when you have an exacerbation. And ultimately, when you hurt more, you do less. And when you do less, that's not good for your general health. I believe the statistic is 83% of American healthcare dollars are spent on 6 things. I'm going to see, I don't have my cheat sheet in front of me, but number one, easily, by far is musculoskeletal issues. That's our number one healthcare spend. It's actually more than number two and number three together. I think number two is number two is diabetes. Number three is cancer. Then we have obesity, depression. So I can't remember the exact order. The point is this: 5 out of 6 of these issues, musculoskeletal issues, diabetes, obesity, depression, are the result of poor quality and poor quantity of movement. The less we do, the more we become susceptible to those issues. Oh, there they are. I forgot heart disease, obviously. Something wasn't adding up. So musculoskeletal is number one, 2 is heart disease, 3 is cancer, 4 is diabetes, 5 is obesity, 6 is depression. That's the order. Now, that's what I needed. So what I'm going to talk to you today is good for your back, but if you can move better and more often, it's good for your general health. I want you to have fewer doctor visits, less medication, fewer surgeries, to live better, more quality life. That's what we're going for. Unfortunately, most people, when they're presented with the initial stages of a problem, do not respond productively. The single greatest mistake that people make is they tend to ignore problems too long. Oftentimes, I'm doing this workshop in my 109-year-old home. When I moved there 9 years ago, we had the insurance company come over, and the adjuster said, we'll insure you, but you got to change that roof. Those shingles are old. They need to be replaced. We're not going to cover that. Call us and tell us when you have it replaced, and we'll add it to your plan. So I looked at the size of the roof, and I looked inside at my ceiling and said, you know what? It doesn't look too bad. I'm not ready to spend that kind of money. I just bought a new house, and I don't want to spend more money. And so I ignored a problem. Now, I'm not going to lie to you. I did a few years later get it fixed, but I was gambling with it. I was rolling the dice on that. And we all know that if we ignore evidence of a problem like that, it's going to become more significant and more costly as time goes by. And that's true in the human body as well. Most people, however, do ignore it as long as they can. But when it gets to a certain level and it's becoming more and more prevalent, eventually we can't ignore it. And unfortunately, the next response is not really getting to the root of the problem. Most of the things we do at that stage is just masking or altering the problem. And this is even true in the medical world. Medications, injections, and surgeries are the 3 most common responses to musculoskeletal issues, and none of them get to the root of the problem. They just kind of treat the symptoms more than anything. We don't often ask the question behind the question. Why is it there in the first place? And can we eliminate that contributor, that culprit? And so my challenge today is get beyond ignoring it, to stop just masking it, but to actually ask the question behind the question and get to the root of the problem so that we can truly solve it. That's what I'm going to offer you tonight. And in order to understand this is what I was talking about earlier. It makes sense that we consider these things to be medical issues. But the reality is, most of these musculoskeletal problems aren't medical issues, they're mechanical issues. It's a movement problem. Our tissues are made to absorb and experience stress, but when we overstress tissues mechanically for a long enough period of time, when we exceed the design thresholds of different body parts, there are consequences, gradual, progressively worsening, cumulative consequences. So if your back hurts, you don't lift up your shirt and take a look and say, hey, look, that dial that says I'm low on ibuprofen, I better take that ibuprofen. That's what I need. That's going to make me better. No, ibuprofen helps us manage pain to some degree, but it doesn't solve the question behind the question. You cannot solve a biomechanical issue with a biochemistry treatment. You need a movement solution. So mechanical simply means movement. Can we help find ways to move in such a way that we stress those tissues appropriately? Okay? Tissues are made to be stressed, and it's okay if we stress them within their design specifications. The problem is most of these musculoskeletal issues are because we've exceeded the design specifications. Now, I do want to point out one thing. I don't want to get too deep in the weeds with this, but if you hear that you've got something that's inflamed, be honest. What's your natural response? Most people are going to say, hey, I can do something about inflammation. I better take an anti-inflammatory, right? That's a natural thing. We've kind of been conditioned to do that. But I want you to understand that inflammation is a natural part of the healing process. When we injure tissue, it's going to go through an inflammation stage. That's from day 3 to about the end of week 3. That is the stage that prepares the body for this development of vasculature, blood vessels that, via the blood, will bring nutrients to the tissue. And when that is led to a proliferation and eventually a maturation phase, we have tissue that gets well supplied with the nutrients it needs to be healthy over the long haul. So inflammation is normal and necessary. It has a purpose. An anti-inflammatory prevents that purpose from taking place. So one of my favorite authors is C.S. Lewis. And he has several books of his that I like, but he actually wrote an essay during World War II called Miracles. And in that essay, I'm going to summarize it because I can't remember it by heart, but he says in there, the magic is not the medicine. The magic is inside the individual. True treatment, if it's going to be effective, needs to do one of two things, says C.S. Lewis. It either needs to stimulate nature's functions or eliminate something that is preventing nature from abiding by its functions. Okay, so if you think about that from this perspective, is an anti-inflammatory stimulating what the body naturally does? No, it's actually stopping what the body naturally does. Is it preventing the body from doing what it's intended to do? No, it's actually blocking that. So we need to think differently. We need to cooperate with the body. We need to help the body experience stresses in a more balanced way. In order to do that, I want to tell you about my friend Andrew. This is a younger Andrew. Andrew is a physical therapist in Traverse City. And in between college and grad school as a physical therapy grad student, he experienced a significant back injury that really wasn't caused by anything in particular. He was 24 years old, and he had been experiencing pain, progressively worsening. And about a year into it, he's like, I got to do something about this. He had done medications. He had been given an injection. Both of those provided some temporary benefit, but it came back. So eventually he had a laminectomy, a surgery done, kind of cleaned that area out, and that felt really good until a few weeks later, and the symptoms worsened. And they said, well, you better take some more medications again. One night he was laying in bed and his wife was listening to his breathing because it was slowing up significantly. When you start taking opioids, that's a concern because that is a kind of a deterrent to respiration. It can slow down your respiration. People that accidentally overdose on opioids simply stop breathing. It suppresses respiration. So she was concerned. He was concerned, getting anxious, depressed, feeling loss. And it wasn't until he started PT school and they started doing movement testing on him that he found out his hips were significantly limited. And I'm going to tell you more of that story later when we talk about the primary culprits. But he didn't have a back problem. He had back pain and back wear and tear. But the real true root problem wasn't in the low back. The low back was just compensating and taking on stressors that his hip could not do because they were not doing what they were designed to do. So that's a little bit of a Easter egg for you. We'll go back to that later. Let's talk a little bit about how your spine moves. It, like every part of the human body, moves three-dimensionally. So it's made to flex and extend. That's movement in the sagittal plane. You can see on there, flexion extension, we move really well in that at the lower back, 70 degrees, combination of flexion and extension. That's usually not an issue. We could also do side bending left and right. That's in the frontal plane. We got about 20 degrees in each direction. So that's 40 degrees, moderate amount of motion. Rotation is something we do as well, but not near as much of that at the lumbar spine because the facet joints will close down. And that's ultimately what happened with Andrew. He couldn't move through his hips, so it settled into his back, and that was the problem. That's important to know because we're going to talk more about those concepts. Let's talk about sciatica first. I want you to understand that sciatica, which is really common, and people know that word because they know someone who's had it if they haven't experienced it themselves. Your sciatic nerve travels down your leg. It supplies motor information to all the muscles of your lower leg, and it brings sensory information back from the leg to the spinal cord and ultimately to your brain. And you can get compression of that sciatic nerve. Sometimes where that nerve exits from the spine, one of its nerve roots, that would cause central stenosis, where you get pressure on the nerve roots. And sometimes that sciatic nerve can get mechanical pressure more peripherally down the leg, in the buttock, or in the leg itself. So the point is this: if you have sciatic symptoms, it's not necessarily a spine problem. you can get pressure on that sciatic nerve peripherally outside the spine. But if it goes down past the knee into the lower leg, it's definitely from the spine itself. Okay. Now, all back pain types could experience some sciatica pain. Sciatica isn't a description in and of itself. It's something that accompanies many of these types of lower back pain. We're going to talk about three of the most common. We're going to talk about a disc issue. We're going to talk about your SI joint. We're going to talk about stenosis. Okay. What about discs? All right. You've all heard of people that have a bulging, herniated disc, a slipped disc, sometimes is what you would hear. At the lumbar spine, and there are 5 vertebral levels at the lumbar spine. It's most common between L4 and L5. About 75% of them occur there. If you look at this picture, the normal disc has all these outer fibrous rings, an inner pulpy matter called the nucleus pulposus. Posterior to that is where the nerves exit at each level. And the weak spot on each of these discs is the posterolateral, right and left sections. And those tissues, those cartilage rings can slowly wear out and that thing starts to bulge, and it can put pressure on that nerve as that exits there, which will send symptoms down the leg, pain, numbness, tingling. One thing to know about this is usually a young person's issue, usually 35 years of age and younger. These people, for bending doesn't agree with them, coughing, laughing, sneezing, even though it can be very painful. If it's just pain only, it's not dangerous. It's very uncomfortable, but it's not dangerous. If you start to have changes in your foot control, your bowel or bladder control, then we're starting to see motor changes, muscle changes. That's more serious. You need attention. You might need a surgery if that's the case. Fortunately, that happens in a very small percentage of these. Most of them are only sensory. And statistics show that you get better outcomes with time and conservative treatment than you get with surgical interventions. 85% will get better with simple movement techniques. Might take a little bit of time, but it does get better. While positive outcomes are only experienced 50% of the time with surgery. And I'm going to give you a little bit more of the story now, too. Surgery might get rid of some of this evidence of the problem, but if the movement issue hasn't been fixed, it's going to continue to occur. Okay, so that shouldn't surprise us. What about the sacroiliac joint? SI joint, you've probably heard of that too. The SI joint, so the spine goes up this way. This is the hips and pelvis. The sacrum is the bottom of the spine. It's where your sacrum and your pelvis come together, the sacroiliac joint. There's tons of weight from the upper body that travels through there into the lower legs. When our foot hits the ground, that travels up through the legs, through the pelvis, into the spine, and it crosses through that SI joint. You don't see it on this picture, but this SI joint has tons of ligaments and supportive structures there. That joint doesn't move a ton. And if it slides around, gets a little bit mobile, dysfunctional, rotates a little bit, that's not comfortable. Sometimes this occurs following an acute incident like falling directly on your butt. But most of the time, it's a cumulative issue too. Pregnant women are more prone to have this because in the process of the hormonal changes, preparing for the delivery of the baby through the birth canal, hormones change and allows for laxity in ligaments. And that is one ligament that can get lax. But just normal people can get this too. And it's usually with transitional movements, sitting to standing, standing to sitting, rolling over in bed. It's usually on one side or the other, like in the dimple of the lower back, but it can kind of wrap around the thigh into the groin. Almost never does it have sciatic symptoms going all the way down the leg. Okay. And when that movement occurs at levels that's not intended beyond the design specifications, that creates mechanical friction, an inflammatory process that puts pressure on sensitive nerves that send the signal to the brain, this hurts. That's the message of pain. Okay. The solution is get rid of that friction by solving the movement issue. That's the goal. And then finally, stenosis. It's kind of a fancy name. That's really just your run-of-the-mill arthritis, any arthritic changes. And by the way, arthritis is really, really common. This could be also described as degenerative disc disease or disc degeneration, osteophytes and bone spurs. This is easily the most common type. Stenosis can occur within the spinal canal or where that nerve root exits. That's called foraminal stenosis. You do not need expensive diagnostic tests to confirm this. If you're older than 50, If your pain is more significant when you're upright, standing, or walking, and it reduces somewhat when you sit, you likely have an arthritic issue. It's a stenosis related issue. But remember, arthritis is really common. Okay. Here's an artist rendering of arthritis. It's not going to be red in there. It's just showing you where these changes are occurring, where the joints come together around that nerve as it exits there. This is the neural foramen. All these things are pretty typical. This proves it to you. This is a study that's been done where they did MRIs of people that have no back pain, no back pain at all. And they find that in each decade, from the 20s through the 80s, these things become more prevalent, whether it's just disc degeneration or more significant disc bulge, or even a more significant protrusion or herniation of that disc. Degeneration on the facet joints back there. This is a facet joint right here. They're all common. These are what we find amongst people that have no back pain. So here's my point. If people are walking around and have these issues and don't have any back pain at all, why are we doing surgeries to fix them? Sometimes it's necessary, but we default to that too quickly. My encouragement is do not try to fix pathologies. Try to ask the question is, why do I have pain? And that's usually a mechanical issue. It's usually a movement related problem. If we can find a way to reduce the stress to the tissue that's crying out for help by making every link in the movement chain do its job effectively and efficiently, that's the true solution to making you feel better and function better. That's a great segue to talk about the true causes of lower back pain. So remember I talked about three-dimensional movement, flexion and extension in the sagittal plane, side bending left and right in the frontal plane, rotation left and right in the transverse plane. Every part moves three-dimensionally, and these parts are intended to have some balance between mobility and stability. If someone's way too mobile and not stable enough, that's a problem. If someone is way too stable and not mobile enough, that's a problem. We need to have a balance between mobility and stability at each of the links in the movement chain. That's something that I call most stability, mobile stability, a balance between mobility and stability. In my clinic, I talk a lot about Goldilocks. Okay, so you remember that story? Goldilocks said, not too hot, not too cold, just right about her porridge. And the bed, she didn't like the soft bed, she didn't like the hard bed, she wanted the one that was just right. So all of your joints need to have a balance of mobility and stability. Most stability is the just right. And the answer to your mechanical movement related problem is to find that which has a dysfunction, whether it be too mobile or too stable. That's really the solution. And so we need to look at the most common culprits, things that if they are dysfunctional would cause your low back to take on additional stresses and cause it to be stressed beyond its design specification. And so the closest neighbors to the low back, okay, this is the closest neighbors concept. Your low back below it has the hips, and above it has the mid to upper back, the thoracic spine region. Those are the two most common culprits, the closest neighbors. They can either be good friends or they could be problem creators. And you know both of those kind of people in your life, right? Spend time around the people that are good to you. Stay away from the problems. Well, unfortunately, your low back cannot stay away from hip problems or thoracic spine problems. But if you can help those hips in the mid-back region move and work the way they're designed to, then the back's going to say, thank you. That helps me. And you can even look a little more distant. The feet are something to consider as well. What about the hips? Okay. So these muscles that we're seeing here are your hip flexors. They all connect to the upper leg. And you can see by their position that if you fired those muscles, it would lift that leg up and flex the hip, right? If you tried to do a marching, standing march, it is these muscles that you are engaging. Some of these muscles begin on the lumbar spine. Some of them begin on your pelvis, the iliacus portion, the sacroiliac portion, okay? Think about the positions we put ourselves in today compared to a few generations ago. A few generations ago, we were working as industrial workers, agricultural, pretty laborious work, right? Everything was harder back then. So, technological advances have made life a lot easier for us, but we become what we do, and we don't do near as much anymore. When you sit all the time, whether it's at a desk, by a computer, in a vehicle, right? Those hips are in a shortened position. the hips flex, those muscles are placed in a shortened position. And over time, those muscles adapt to the positions that we put them in. If those muscles get tight, think about what happens when we stand up. Okay, like a rubber band, it's going to either pull your hips into flexion, or your pelvis is going to get pulled forward, or your spine is going to get pulled forward, and that can put mechanical stress on joints that for a while is not a problem. But little by little, remember this? A little more stuff's happening. We don't even know because it's not above that symptom threshold. But we get enough stress for long enough, we start to get a little bit of pain. It's not common, it's not all the time, it's not bad. But if we don't change the stress, we don't change the experience of cumulative trauma, it tends to progressively worsen. What about if you have both a hip issue and a thoracic spine problem? Okay, so thoracic spines typically are not overly mobile. Almost always, almost exclusively thoracic spines, if they have a problem, are too tight. So think about this. You don't hear a physical therapist say this much, but I want you to slouch, okay? Just slouch. Now stay slouched and try to rotate your trunk right and left. We can't do it. You can think, you almost feel like an old curmudgeon when you try that one, okay? Now, instead, sit nice and tall, and now see how far you can rotate your shoulders and your trunk as you do that. From that upright position, we gain better mobility in all directions. That opens up three-dimensional movement. But over time, gravity takes over, and we do get a little bit more flex throughout that thoracic spine. And a flexed thoracic spine can't rotate as well. We lose mobility here, and the neighbors need to compensate for that. The closest neighbors in your thoracic spine are the lower back below and your cervical spine or neck above. So if you've had both neck and lower back issues, the common denominator in many, many cases is your thoracic spine. What about your feet? Look at that person, the left side there, that foot is pronated, right? A flat foot. And look how that changes the angle at the knee, at the hip, the curvature of the spine, the angle of the shoulder blades, all the way up to the cervical spine. So a really, really poor foot may need better support to bring you better balance and stability and positioning near neutral at all the other joints up the kinetic chain from that. But here's another thing. Most foot issues aren't foot issues. The foot is compensated due to another problem, and it actually is usually a bad hip. So the hip oftentimes comes back to the hip. The bottom line is this, folks. If you have lower back issues and you've tried ignoring it, you're not there anymore because you're talking to me tonight. Or if you did something about it, but unfortunately, all too often, the things that we are encouraged to do are just masking the problem. Medications, injections, surgeries, even in physical therapy, ultrasound, electrical stimulation, that can make you feel a little bit better for a while. But if you haven't changed the movement issue, it's not going to last either. So ETs are even to blame for this at times. The bottom line is you got to look at your thoracic spine, look at your hip, and look at your feet. Find the movement issue, or unfortunately, the movement issues. It's oftentimes for people not one problem. It's a little of this, a little of that, and a little of the other thing. But if you find and fix those issues and help them do what they were designed to do, your back is going to say, thank you for taking the stress off of me. And I can promise you, I can't promise you, certainly not by snapping your thumbs, can your low back get better. And if you've been dealing with pain for a long time, it may not be possible to be pain-free 100% of the time. But I know that if we take stress off your low back by looking at the mechanical neighborhood, okay, the movement and all these links in the movement chain, we can take stress off that tissue. And tissues that receive less stress have less frequent, less intense, shorter duration pain. I can guarantee you we can help you manage that pain better by going to the root of the movement issues, okay? So it's not going to be at all a surprise based on what you've heard me say already, is that to eliminate the pain, you got to go to the root cause. And the most common treatments are not root cause treatments. They are just masking it. So don't hear what I'm not saying. Sometimes injections are necessary. But if they're being done at the expense of getting to the movement issue, you're simply kicking the can down the road. It is almost always going to come back, and it's going to progress. It's going to get worse over time. So successful treatment is very individualized. We need to know what your movement dysfunction is, or what your movement dysfunctions are. And we can't look at your low back in a vacuum because it is part of a dynamic system of movement. So we need to look at the whole body and all the moving parts. Because when you exist between gravity and the ground, they have to work together well and efficiently. And that process of determining that is very educational and empowering. And so the point is, you can't just do one exercise and get better, because as your body changes, you need to do the next thing and the next thing. You need to be educated and empowered to do the right thing at the right time to get the right results. And that whole process is very individualized and one-on-one. It's legal for us to work with multiple people at the same time. We don't do it because it isn't effective. Not in the long run, it isn't. And we do lots of hands-on stuff. I stretch people's tight hips. I help them move the thoracic spine. But ultimately, I need to help them do that in functional, active, hands-on activities with foot on the ground, but in an upright position, because that's where life occurs. Those hands-on activities need to be combined with real functional movements. That's really important. So remember what acute trauma looked like? And then cumulative trauma, we said little by little. In fact, this is the start of acute trauma. Ideally, when you get evidence that you're getting a little bit of pain, frequency, intensity, and duration, if we can get rid of those stresses, the mechanical movement stresses on that tissue, we can drop that below the symptom threshold so that you feel better longer, because you've gotten to the root of that pain. Now, good information, but we haven't solved all the world's problems. First of all, our memories are limited. You're not going to remember all this. Shoot, I've been doing this for 28 years and I still need reminders from time to time. Second of all, and this is even more important, you've been taught about what the most common culprits are, but you still don't know what your problem is. And in this format, we can't do that. I can't tell you what your problems are. It's not hard to do, but it is hard to do in this format. And then finally, we like to say that knowledge is power. That sounds really good, right? But I'm here to tell you that knowledge never did anything to anyone who didn't implement it. You have to be able to implement it. So you've been given a lot of information. I've shared with you some knowledge, but you don't know what your problem is, and you've not learned how to implement it for your particular life. So that's what we want to do for you. That's why, for giving me about 45 minutes tonight, I want to offer you something for your time. A simple 20-minute free injury screen, low back consultation. And through some simple questions and simple assessments, in 20 minutes, you're going to get to the root of this thing. You'll know what type of back pain you're having, most likely. The person who does this will be able to tell you, here's the reasons this is occurring. Here are your mechanical culprits and your particular needs. And then finally, for us to make this go away, this is what it would look like. Here's a solution for you. Here's what the process looks like. And ultimately, you're going to get some confidence, some direction, and hopefully some hope. Now, there's tons of benefits to this. When I was younger, I was not near as bold about this, but I have done this way too long, and I've seen way too many people that waited way too long and spent way too much money on this stuff. So electing to do this tonight will help you stop wasting time and money, because you can actually get to the root of the problem. It'll give you options for taking control of it, and it's all natural. In most cases, you don't need medications, injections, and surgeries. You don't need those risky procedures and the side effects that medications can bring. And you're going to get a unique solution for your unique problems. That's what we promise you. That time is worth something. It's worth $150, but I'm proud to say that we want to give this to you free, absolutely no cost and no obligation. Now, I can't offer you a money back guarantee because I'm not taking your money, but I'm saying this. If you choose to do this and you say that was a waste of my time, just tell us. We will give $150, the value of that time, to your favorite charity. We love helping charities. We've done a lot of that over the years, as much as we can anyway. But I'm happy to say that no one's taken us up on this, because it is not a waste of time. It's valuable. And I'll also say this, it is not a high pressure thing. It's information, and then you are given the options, and that's it. At the very least, you'll have a written summary. You'll have some knowledge about what your culprits are. You'll have an awareness of what an implementation plan would look like if you chose to do that. And that consultation report's there for you to take home with you. But you can't get to that point unless you actually spend just a little bit of time with us. And so the easiest thing to do, that's a QR code. If you want to do that, you can sign up for a free scan that way. The easiest way to do this, though, folks, is just to click on that chat box and say, I'm in. I want to see someone. I'll take the free screen. I'll spend 20 minutes with someone. If you do that, you have to tell us where you want to be seen to. So they're on the screen there. Are you closest to Ames, Des Moines, Newton, Colfax, Pella, Oskaloosa, Albia, or Centerville? Tell us where you want to be seen. Oh, I'll come back. I'm going to click these chats. We're seeing people here signing in. So let's see. Dave said he's in. Dave, I thought you were in, Pella. I figured that's who that was. Sandy says she's in. She wants to be seen down in Centerville. Sandy, you're in luck. Ashley's one of our finest, youngest, and brightest. You'll see her there. Let's see. Jonathan, we will see you in Oskaloosa. That's awesome. Our care coordinator will call you and get a time set up for you that works really well for you. Let's see. Daniel, Des Moines. Okay, very good. We will do that too. Let's see. That is Candace. We'll give you a call in Des Moines and get you set up at a time that works well for you. Let's see. We got two of you asking for Ames. That's great. Jerry is in. She's in Oskaloosa. Thanks, Jerry. Let's see. Margie is on her way out, but she's still there. Margie, ready for retirement. First person in our company that is retiring with us. That's good. Carol's also in Oskaloosa. So Carol, be happy to help you there too. If you want to keep reaching out, that's fine. I'll review this, but I wanted to show you that this is my contact information. You want to call me directly, text me directly. That's my number. That email address gets right to my inbox too. But like I said before, if you've been getting our emails following registration, if you reply to that, that gets directly to me as well, or they'll get that sent to me as well. You are going to get another email either tonight or tomorrow. There will be a link for this thing. I think I did start the video, didn't I? Hopefully so. I think I did. So you'll get a link to this. If you want to watch it again, you can. Do me a favor, would you? If you know people that are dealing with lower back pain, sciatica related issues, just send them that link and tell them to watch it too. We'd love to share with them, and we'd offer them a free screen too if they take us up on that. Like I said, too many people are dealing with this for too long. They need to learn the root of their problems. Maybe you can link us to someone who's looking for that kind of help. There's a link on there to sign up for a free screening, but if you put your name in here already saying you're in, you do not need to do that. You can ignore that part. Yeah, meanwhile, I look forward to you getting some help if you need it. So you have my contact information now, folks. I appreciate very much the time. It is 46 minutes in. We did a good job tonight. Thanks for being a good group. I'll review the comments that I got too. If any of you left any messages, I'll get back to you on those things. And you are welcome to reach out at any time. Hope you had a great Thanksgiving and have a blessed Christmas upcoming as well, or holiday season, whatever you celebrate. Jerry, thank you too. I appreciate your time tonight as well. Blessings to all of you, and hope that we can find a way to help you feel and function better. Take care.